Hi, I'm Shaye Mandle, President and CEO of LifeScience Alley. And if you've ever been to our LifeScience Alley offices, you know I'm not speaking to you from there today. In fact, we're at one of the most innovative facilities in the entire world, right here in the heart of Minnesota's Medical Alley at one of our member companies. It's truly an honor to speak to you today about the future of LifeScience Alley. We are committed to leading the conversations that will change the face of healthcare. Over the past 30 years, our members have been doing just that. This is the birthplace of medical technology, one of the fastest growing biopharmaceutical industries in the world, a growing diagnostics cluster, and perhaps most importantly today, we're seeing a huge boom in digital health. Minnesota is inventing the kinds of technologies and patient access that will change the way healthcare is delivered, consumed, its outcomes, and its costs. And LifeScience Alley has been at the center of those innovations for the past 30 years. In fact, this summer, the Smithsonian is launching a new exhibit in Washington entitled Places of Invention. And there are some great places of invention. Silicon Valley, Hollywood, the Bronx. It also includes Medical Alley, Minnesota. And so as we celebrate our 30th year as an organization serving you, and the Smithsonian recognizes the innovation of this community, I wanted to take a couple of minutes and just share with you where we're headed as an organization and why we're doing the things we're doing today to better serve you. First and foremost, we've been listening. And I want to encourage everybody, reach out to us, go to our website, follow us on social media. It's a great place to get connected to our community and a great opportunity to give us feedback on the kinds of programs, the kinds of public policies, the kinds of activities that your company could use to be successful. As we've listened, we've put ourselves in a position to really be laser focused on the items that you care about the most. First and foremost, we're building a much broader member services organization. Great programming, senior level networking, technical training, and a host of other events, including our first annual meeting on April 23rd, which will bring our entire life sciences community together for a wonderful evening that will feature Dan Buettner from Blue Zones. Later this year, we'll expand what we've been doing with our conference by partnering with some organization to bring more people, but the same great content you're used to from LifeScience Alley. Our public policy and advocacy work has really ramped up in the last couple of years, and we find ourselves today having amazing relationships at the state capitol in St. Paul at a time when they're really recognizing the value of what you do, as well as working with partners in Washington, D.C., including our key federal legislators, to make sure that United States policy is conducive to our growth, expansion, and that most importantly, patients are getting the therapies they need when they need them. And finally, we've launched this year a new research, intelligence, and information arm of the organization. You asked for data, you asked for information, you asked for us to provide you with the insights that we see every day by talking to cross sections of our membership and talking with members from government, the public sector, private sector, academics. And so we're compiling a host of infographics, industry reports, investor reports, the kind of data and information you've asked for, actionable intelligence that will help you to make better decisions and us to be a more supportive organization. Finally, I just want to say thank you to all of our members who've been supporting LifeScience Alley over the past 30 years. We have an amazing opportunity to be the organization that is leading the conversation about the evolution of healthcare. And the leaders of that conversation are the greatest healthcare and health technology minds in the world, and they're right here in Minnesota. Our primary objective is to make sure that that expertise is driving the influence and the innovation behind how healthcare transforms, and it is our objective to lead that conversation with you and for you for the next 30 years. We'll see you all at the annual meeting on April 23rd, and I look forward to chatting more about how Life Science Alley can be your indispensable association. Thank you.